Start.
Hi, my name is Courtney Allen, and I have been a registered nurse for 2 years. I got my associate's degree at the College of Central Florida, and I got my bachelor's degree at the University of South Florida. Next month, I am starting graduate school and getting my master's in nurse practitioner. What I like most about nursing, I would say, is meeting my patients. When you see a lot of sick people and then you watch them through their journey here and then you watch them get better, that's really cool to see. And probably what I dislike most about nursing is the administrative part of it. It can be political at times, and they're not seeing it from our viewpoint, so that can make it a little difficult. And that's it.
And I'm Tina. I'm a registered nurse, and I've been a nurse for 1 year. I graduated from the College of Central Florida last May 2014. I've been here at Ocala Regional on the neuro floor for 1 year. I see myself in the future getting my bachelor's degree, and I want to be a leader. So I want to be that administrative role. I enjoy patient care. I too like to see the patients come in and watch them get better. And then what I dislike about this job is for the patients that you can't help, the ones that you can't make better, and you can't comfort the families.
Sometimes you have to find a balance between treating people and pleasing people, and there's a difference. Sometimes it's the same, sometimes it's different.
And you have to learn to leave it at work.
Yes, because it can be very stressful.
And very, heart heavy, because I know I still go home and I think about my patients even on my days off. Like, are they okay? Did they go home? Did they go to rehab? Did they make it through their surgery?
Yeah.
Okay, well, what sort of characteristic would you say is the most important thing that you need being a nurse?
Compassion,
Compassion.
And patience
time management.
and kindness, and definitely I would say being, what's the word I'm looking for? Conscientious of what you're doing.
Mm-hmm.
Some people say that to be a little OCD is a good thing to be a nurse, because being a nurse, it's a huge management role, and you're managing 6 people at the same time, and you're managing their whole healthcare team. That involves the doctors, the nurses,
The techs.
And speech therapy, physical therapy, occupational therapy, pharmacy. It's a lot.
Radiology.
So you're managing really sick people. So you definitely have to, a patient will mention something to you, and then you kind of have to remember it. It's a lot to remember at the same time. So definitely being, a little OCD and watching what you're doing, and that's an important trait.
Okay. Now, what made you guys pick the hospital versus nursing home or a doctor's office, or what do you like about the hospital that
I worked in a doctor's office, and as a new nurse, you can't learn the whole aspect of nursing in an office setting. You need to go to the hospital so that you can learn every part of it.
Mm-hmm.
In nursing school, they give you a med-surg foundation, which is just medical and surgical patients, and that's where the basis of nursing comes from. And you can't really work at a doctor's office. I mean, you can, but you need that foundation, and you don't get that experience unless you work at a hospital. And they recommend at least a year minimum, probably a couple years. So, especially people who start out and they've never been in the medical field, you really need to work in the hospital to gain that knowledge and that experience.
The diversity and the different types of patients and the type of problems they're going to have, because your patients are not just going to be cardiac. They're not going to be diabetic. They're going to have all of the symptoms, all of the categories, and you have to be able to treat everyone as a whole.
Yeah.
Now, what would you say was one of the hardest things about your education while you were learning to become a nurse?
Being away from family.
Yeah, it's, nursing school can be tough. It's a lot to manage. It's a lot to learn in a short amount of time. So, they kind of give you a little information in the beginning to your family of what it's like to live with a nursing student, because it can be hard. But yeah, definitely just managing it all and trying to keep your personal life separate.
Okay. All right. Thank you, ladies. I really appreciate you taking the time out to do this interview. Maybe we'll learn something from it.